Hi everyone, thank you for joining me. I'm calling the series Ask the Egg Whisperers, and that's because I have me and myself, no I'm just kidding, and Dr. DeUgarte, and we're gonna be on tonight, and every time we say balls, you're gonna take a shot of tequila because it's Friday night. Just kidding. So we're gonna take your fertility questions, and you guys sent me so many questions tonight, and I can't wait to bring her on, and we're gonna talk about them, and we're gonna have a good time because that's what we do. When Catherine and I get together, that's what we do. We literally talk about fertility. That's it. We're pretty boring to be around, but for us, that's pretty darn exciting. You know, she's my person. Like if I have something that I want to run someone by, it's her. Same thing. If she has something that she wants to run someone by, it's me. She's like the Thelma to Louise. She's like the Gail to Oprah. She's my person, and there she is. So I'm going to invite her on right now. Where is she, Catherine? Catherine, you have to ask. Sometimes I have to teach her a little bit about technology. You got to ask me to join me live. Go live with, there she is. I'm going to invite her. I'm waiting for her. Wait for it. Here she is. Hi, Catherine.
Hi, how are you?
I'm doing good.
Hey, and look, we kind of match. Look,
We're kind of matchy today, and we didn't even try that. And we also both have flowers behind us.
How are you?
I'm doing good. It's nice to see you. Are you ready to party? Are you ready to answer some fertility questions? Okay, let's do this. Okay, here we go. Hi, Dr. Aimee. Looking forward to your episode today. A few questions, if you can answer, would be great. What should be an optimal time between 2 IVF cycles? What do you think?
At least 1 month off between.
I agree. I know there are folks out there that they say you can go right into another cycle and the egg count doesn't change, but I honestly think that the body needs 1 month to recover. Okay, I'm glad you agree. But certainly there are times where you just want to go back to back for different reasons. Maybe it's insurance or timing, or maybe your partner is going to be deployed or something like that. Okay, next question. How can we prevent endometriosis from developing back again? Is it related to food, lifestyle, and does it rarely come back after the first pregnancy? What do you think?
I think the best thing is birth control pills. If you don't need to get pregnant, birth control pills continuously will help prevent it. Mm-hmm. Nothing's going to completely eliminate it, but at least not having periods will help.
Okay. Yeah, and I agree. I mean, preventing endometriosis, the other thing is N-acetylcysteine is a supplement that has been shown in some studies to prevent to slow the progression of endometriosis. And it's kind of like a catch-22. Endometriosis can be treated by pregnancy, but sometimes it's hard to get pregnant when you have it. So that's kind of annoying. Agree?
Agree.
Okay. Here we go. Next question. I recently had an ERA test and was told earlier this week that they found plasma cells, and I'm now taking antibiotics for the next 2 weeks, hoping the inflammation decreases. Should I be concerned about this?
No, but I definitely think it's good to take antibiotics. I usually prescribe it for 3 weeks, actually.
3? That's a long time.
Oh, I know that's a really long time, but that's what I was taught in fellowship.
I know, and you taught me a lot too in residency. I mean, for me, I put patients on antibiotics before their egg retrieval. I put them on antibiotics before their transfer. So I you know, by the time they get to a transfer, they've been on like 4 weeks of antibiotics.
I actually don't usually use it, only if they have endometritis personally.
Got it. Well, you're nicer than I am sometimes, except when it comes to progesterone and oil. You're a lot meaner than me. Okay. So she's asking now, this could be the reason why my first IVF implantation failed. I transferred a healthy PGS tested embryo and it didn't stick. My doctor is estimating my second transfer will be at the end of August. I have only 1 healthy normal embryo left, so the second cycle really matters. Okay, so let's get to the fun part. My best friend is having her bachelorette get together Labor Day weekend on the East Coast. It should be pretty low key. Yeah, right. I don't believe you. If I proceed with the embryo transfer before Labor Day weekend, then I would be taking progesterone and oil shots during the weekend, which will be too risky since I cannot administer the shot myself. I think it would be best for me to postpone the embryo transfer 1 week after Labor Day weekend. Am I crazy? What do you think?
I would definitely postpone it. I would not go because of COVID, because I think she could get it on the plane.
I agree. I tell everyone, wrap yourself in bubble wrap. Stay away from anyone that looks like a human, breathes like a human, acts like a human for at least 2 weeks. Or what?
You could rent an RV and have a bachelor party in the RV on the way to the East Coast.
I mean, maybe she lives on the East Coast and it's not that far of a drive, right? I mean,
right.
I don't know where she lives.
But still, then she can't drink and she can't have fun at the bachelorette party, and she has to give herself shots.
I agree. And
they're going to be too drunk to give her the shots correctly.
Or they'll fall asleep before they do the shot.
That's happened. Yeah.
I've seen it too. Okay. So here are some more questions. This is another person asking, here we go. I've been told that I have a tricky cervix and I have a retroverted uterus. The doctor has a heck of a time getting the catheter in for IUI. Is this normal, or would this affect my ability to conceive naturally?
It does affect ability to conceive naturally, but there are things you can do to help out, such as taking Valium the day of the insemination or doing it with a full bladder. Sometimes it helps, especially if it's anteverted, not so much for retroverted. Sometimes I've even done inseminations or transfers while people were asleep under anesthesia if it's very, very difficult.
Right, totally. So, abdominal ultrasound guidance will help, taking a little something like a Valium. But a tricky cervix at home, I mean, I don't know. You really think that's going to affect her chances naturally?
No, what I usually say, if period comes out, then sperm goes in.
I agree. They might get a little lost along the way. A lot of them get lost along the way.
You can't ask for directions. That's a problem.
They can't. No. Okay. I'm 35 years old. I took birth control pills for 20 years. I stopped 3 years before we started trying. My ALK-Phos blood levels have been low in every blood panel I've completed for the last 5+ years. Could a low ALK-Phos affect my ability to conceive? I read it might play a role with the lining.
No, I've never personally heard that. So I would say not.
I'd say you're okay. I agree. Okay. Next question. I'm 31 years old with infertility from a bilateral hematosalpinx, possibly from surgical scarring from endometriosis. Prior history, left oophorectomy and cholecystectomy. For those of you who don't know what that means, she had her left ovary removed and her gallbladder removed. She now has a 2-centimeter endometrioma on her right ovary, and her most recent AMH was 1.5, down from 3.5 a year ago. She has done 1 round of IVF with 14 eggs, had 2 embryos, and 1 failed implantation. The embryos were not genetically tested. And then she did a 2nd round of IVF with 10 eggs, 4 mature, and 1. Catherine, I'm losing you. Your head, you're shrinking again.
Really?
You're sinking.
I'm
used to.
I'll move my phone.
What am I going to do with you?
There we go.
Seriously. Okay. So 2nd round of IVF, retrieved 10 eggs, 4 mature, and 1 day 5 embryo, and we're now waiting for the blast genetic results. My main question would be surgery first, meaning should I do surgery to remove the endometrioma? And just to remind you, it's a 2-centimeter endometrioma, or do another round of IVF prior to surgery? What do you think?
I definitely think she should do another round of IVF prior to surgery, but I don't think she needs to have surgery to remove the endometrioma. I don't usually remove 2-centimeter endometriomas because it can damage the ovary. Now, what I would consider doing surgery for, and I don't know if you mentioned this, is if that tube is dilated, I definitely would remove that tube or block it, actually.
Yeah, I think that she might have already had that blocked, or I think that is definitely going to happen. She will.
Okay. So if she had the tube blocked already, I wouldn't touch the endometrioma because it could damage the ovary personally.
Right. But if she's not, then she might as well remove the fallopian tubes and potentially remove the endometrioma before transfer, because it might help her with her transfer success if she has less endometriosis in her body, right?
Yes and no, but I don't think there's studies that show the 2-centimeter endometrioma, if you remove them, makes a difference, personally.
Well, I think if you look at the receptiva score, the BCL6 score, and if that score is elevated, then potentially she could have some implantation issues if there's a lot of inflammation in the lining.
Right. But if there's endometriosis only in the ovaries and not in the lining, then it
exactly. Bam. What's up? Yep. Yeah. I agree with you. I'm right there with you. Okay.
But that's a tough situation. I wish her the best of luck.
I agree. I'm sure she's obviously a very, really hardworking person and deserves the very, very best. Anyone who's gone through that much with all that pain and the number of surgeries, having her ovary removed and the gallbladder removed, and that's a lot. So she's saying she's taking a 2 to 3 month break for now. Okay. So Catherine, I learned a new word today, and I think I might have made it up, and maybe I need to have it trademarked. Are you ready for this?
Yes.
Now I forgot it. What was the word?
It's been a long day. It's been a long week. You're allowed.
Oh, here. Wandum. So I had a patient who looked at me. I was putting the transducer cover. I call it a transducer cover, not a condom, on Wanda, which is the vaginal ultrasound probe. Yeah. And she goes, "Oh my God, you're putting a condom on Wanda." And I was like, "Oh my God, you put that together as Wandum."
I like that.
Right? So you can buy your Wandums. Wandums are special. I don't think anyone's going to want to buy that trademark from you in the future.
I think that'd be good.
Yeah. And then I said to someone, sex marathon. I thought that was funny too, like have a sex marathon.
Yeah.
But that sounds very tiring. I don't know that I would ever want to have a sex marathon.
Well, if you have to ovulate, what else are you going to do? Especially nowadays, there's nowhere to go.
That's true. Then you could have the sex marathon.
Yeah.
Okay. Next question. Are you ready?
Yep.
Okay, here we go. I'm 41 years old and have had 2 failed transfers of PGS tested embryos and 1 natural ectopic pregnancy. I had an ERA and laparoscopic surgery to check out my insides. I had blood tests for any immune issues. They all came back normal. For this transfer, my doctors put me on prednisone starting 2 weeks before cycle day 1, 162 milligrams of aspirin, antibiotics starting with my estrase, and a combo of PIO and vaginal suppositories. Can you please explain the benefit of progesterone? That's
For transfers, what are the benefits?
Yeah.
Well, that's the most important thing that she's on for transfers.
Yep.
So it basically helps with implantation of the embryos, and it helps cushion the lining. Is the way I would look at it. But that's the most, if I had to choose one medications among everything that she's on, I would say the shot progesterone would be the most important thing for implantation.
Right. And it stands for promote gestation, right? Without it, a pregnancy can't occur.
Yep.
And so her other question, and her other question is, anything else I can do to help? What do you think? What else? Can you think of anything else you could possibly do?
Acupuncture.
Acupuncture.
Relaxing, taking it easy, not having stress around the time of the transfer.
Got it. So she's actually chatting us live right now, and she's clarifying that she did not mean progesterone.
Oh.
That really her question is, can you please explain the benefit of prednisone?
Prednisone. Okay.
Okay. What do you think?
Sense. So when I was a fellow at UCLA, we used to use it for everybody. We used to use Medrol for everybody. But then there were studies, and there's been many studies since then, that it doesn't really make a difference. But I do use it for patients with implantation failure or patients with recurrent pregnancy loss. So in some patients, I think it is a benefit if people have failed previous transfers. But I use it for less than 2% of my cycles, honestly.
Yeah, I mean, prednisone for that long, I wouldn't want to put myself on it because of the side effects associated with it.
Weight gain.
I do, weight gain, yeah. I still put everyone on Medrol 4 days before their transfer. It's just something I've always done. I guess it's out of habit, but I don't think it clearly doesn't affect my pregnancy rates in a negative way. And I don't want to stop it because the pregnancy rates are so good. Right.
And one counter argument to that is that steroids, if you're on them long term, it can increase risk of infection. Now with the whole COVID situation, I don't know if I'd want to put people at risk.
My patients, after they're transferred, they are given this like bubble wrap that they just put around themselves.
I like that. Yeah.
Yes.
Kind of like those suitcases in airplanes.
Yes. I haven't been in, yes.
A long time.
Just put them, it's been a while since I've been on an airplane. So I don't know.
You can make an Aimee wrap.
Yes, exactly. Okay. This one's a long one. So I'm going to sort of abbreviate it. Okay. Here we go. If you were to throw the kitchen sink at this, what would you do next? How can we make glass? And she wants to add that we are not allowed to say use donor egg or donor sperm. Okay? Here we go. She is 45 years old and 7 months. Her AMH is 0.13, FSH is 13, follicle count is 7. She has done 6 IUIs, 5 IVFs between the age of 43 and 44, 5 IVFs at 45, no transfers. Total eggs collected over 10 cycles is 68, total mature 64, total fertilized 58. Okay?
A lot.
That is a lot. This is a woman on a mission.
Yes.
She is stubborn.
Amazing what she's been through.
That's pretty intense. I mean, she's trying to defy all odds. And what I would say is you've definitely given it your all. So to keep going, she's described the different protocols she's been on: estrase priming, agestin priming, omnitrope, dual trigger with 5K of HCG and 40 units of Lupron. She's frozen everything, transferred, let's say, and hasn't had a positive pregnancy test yet. She's had blasts even like 6AA to 3BB, and has had 1 euploid, but guess what happened to her? She transferred the one that had normal chromosomes, and it turned out to be a Down syndrome pregnancy that ended up, I know. Can you imagine? Like,
yeah, it's awful.
Apparently there was some report, she shares in this question, that the report was inaccurate. So then she went on to do more treatment, birth control pill priming, no blasts. More recently, she just hasn't been able to get a blast, and it looks like her last 3 cycles. So you're not allowed to say donor egg, Catherine.
Right.
If someone who's over 45, what would you do?
So I am allowed to say adoption. I am allowed
Catherine,
to
oh, I
say
guess you are. And adoption is not,
there's always an option.
yeah,
Donor
I mean,
embryos. That's not donor egg. I'm not saying that.
don't be
And
a smart ass.
the other option is surrogacy. I mean, obviously that's extreme, unlikely that that would work, but supplements would be something I could think of if she hasn't
Yeah.
tried supplements.
Okay, I'll tell you what she's on. DHEA, CoQ10, vitamin C, D and E, myoinositol, NAC, RLA, omega-3 with DHA. That sounds like it all
Sounds
rhymes.
like most of them. And the other thing is growth hormone priming, which is what you do a lot of.
Yeah, yeah. She's on levothyroxine, metformin. Enthusiasm to continue has not waned. Okay, so you're right. I would do HGH priming. I would consider NAC. No, not NAC. NAD. It doesn't look like she's on NAD. I don't see that she's on acai berry, resveratrol, pterostilbene, on those types of supplements. So I would add that.
Melatonin.
That's not on there. Yep, I would include melatonin. So yeah, I think we have a couple suggestions for her.
Right.
So if she still wants to try one more time. And as far as protocol, my special protocol, it doesn't look like she's been on it yet. I would like to use, if someone like this came to me with, the potential to get maybe 7 eggs still, I would say maybe a combination of like Femera and Menopure and do an antagonist cycle with the same double Lupron, double dual trigger that you've done, and we'll see what we get. Okay.
Yep.
I'd love to hear back from her to see what happened, because
Yes.
I always tell every patient who sees me over the age of 45, and I'm actually doing an egg retrieval very soon on someone who's over 46. And the last cycle, we got 2 blasts that weren't normal, and we have another one coming up. But my point is that with every patient, that's another chance to help them. And I want to be able to say that I can help someone over the age of 45 have a healthy pregnancy, and I haven't been able to yet.
What's the oldest you've had that has delivered?
Delivered. She delivered at, I've had someone I think deliver at 46, but my oldest euploid embryo for someone is 45.
So I did have one 46-year-old that had 3 normal embryos at 46 and delivered at 47. She had 20 eggs. So I have seen it. That's my oldest that I've seen.
So I mean, that's the thing. It's like, you just never know. So we have to give these women a chance.
Right.
We have to.
She really has given it a very good chance.
Yeah, I agree. You're still shrinking.
Really?
Yeah. There you go. I'm buying you a tripod, just so you know. You're gonna get it.
I have the cool lamp you're recommending that's got the phone case.
No, you can't use that lamp. That lamp doesn't work very well. No, you got to use a tripod.
Right. I tried that the first time. It didn't work very well.
I need to drive down to LA and see you and set it up myself. Okay, here we go. Next question. My question is, are you ready? I love how you guys are so good with asking your questions, that everything is bold and underlined. Should I turn to donor eggs, or is there a chance my eggs will work? What is the reason for my embryos not developing past day 3? And then she gives us a little bit of background. Okay, she's gone through 2 IVFs. Both times, none of the embryos made it past day 3. She's super healthy, 26 years old. Partner is 33. They've gone through many letrozole cycles as well. She's been told that she has stage 1 endometriosis, PCOS. The sperm came out fine, 30 million, motility 40%. Her AMH is high. They went to a geneticist. Genetic testing all came back normal. They've headed into IVF number 3 in September. They are headed into IVF number 3 in September. And she's scared that this will lead into the exact same thing that happened in the last 2 treatments. So first cycle got 22 follicles, 13 eggs, only 1 fertilized, and 10 were immature later. And basically they didn't have any blasts. The second cycle, they got, it looks like she had 39 follicles, 10 eggs, and 4 fertilized, and none made it past day 3. So I have an idea as to what I'm thinking here, but I'm so curious as to what you're thinking.
So a few thoughts. Number 1, I would want to evaluate the male factor. Just do the advanced sperm testing just to make sure, because sometimes when you don't make it from day 3 to day 5, it's a sperm related issue. So I would want to do an advanced sperm test on her, on the partner. And then the second thing would be, again, supplements, to consider supplements, different protocol, maybe adding metformin. If she has a high IMH, she might have PCOS.
Right. She said she has PCOS. I agree.
Sometimes metformin helps I don't use metformin for all PCOS patients, but for situations like this, sometimes that helps. And just trying a different protocol, and sometimes actually adding growth hormone, even though you have PCOS, sometimes can help. I've seen that.
Yeah, I mean, my thing is when I look at this with the number of mature eggs that you're getting, it's quite low for the number of follicles that you have.
Mm-hmm.
And sometimes when you stimulate someone with that number of follicles, you trigger them too early, so you're not getting as many mature eggs. So this would be a perfect scenario for using a combination of, for example, letrozole with low-dose gonadotropins. Let the eggs grow. You know, I
Mm-hmm.
just did a cycle like this and I got 25 eggs and 17 mature from someone in a protocol like this. So the
Wow.
goal is to get as many mature eggs as possible. And then there could be a fertile, you know, I totally agree with you. I mean, if her fertilization rate is 40%, there's something going on.
Right.
So she might be a candidate for something like calcium activation. I don't know if her lab can use spindle view to see if there's something wrong with the actual spindle in her egg, and maybe that can help her decide what to do next if the exact same thing happens again. But I totally would advocate for pushing the eggs so they're a little bit bigger so you
Mm-hmm.
can get more mature eggs and potentially using a stimulation so your doctors won't be afraid of hyperstimulation, right?
Right. Yeah, that's
Okay.
gosh, she's been through a lot.
It has. Okay, here's another question. Are you ready?
Mm-hmm.
Okay, good. 33 years old, BMI is 21, and the diagnosis is unspecified infertility. AMH is 0.83, HSG is normal, slightly tilted uterus, no PCOS, endometriosis, gone through 3 IUI cycles, and did IVF in July, okay?
Okay.
5 follicles, 2 eggs, okay? And then it looks like 1 fertilized, and then ended up with 1 blastocyst that was a BC quality and currently waiting for PGT results. So she's asking, I've requested an ERA biopsy prior to transfer, and is there anything else that you would recommend? And then the other question is, should I proceed or do another round of IVF to retrieve potentially more eggs?
So I would do another IVF if they want more than 1 kid, because most likely, unfortunately, that embryo will be abnormal from what you're telling me. Again, I would recommend supplements and maybe trying a different protocol and acupuncture and just lifestyle changes, like a really clean, healthy diet, and trying more medications, maybe growth hormone if she wasn't already on it. I don't remember you telling me the protocol.
Exactly. I mean, I agree. So take your sperm and egg quality supplements with an AMH of 0.8, and the fact that you had 5 follicles, there's probably still a really good chance that you could get 5 eggs rather than 2. And there's so much cycle to cycle variability. Track and trend your FSH and estradiol levels and see what's going on, and maybe consider HGH priming and adding HGH to your protocol. And then, you know, I think the reason why you're saying that that embryo is likely abnormal is probably because the quality is pretty low.
Yeah, I think
Yeah.
so.
So a BC, I would say, even if it's normal, what would you quote someone with a BC blast as far as what the chances of implantation would be for that blast if you had that quality embryo?
If it was normal.
If it was normal.
And how old is she?
33.
33, maybe 10%.
Yeah, I mean, I agree. I would say don't expect a higher than 40% chance of pregnancy. And I would definitely encourage you to do another cycle and don't give up.
Right.
There's so much, it's like IVF is like a box of chocolates. You never know what you're going to get.
It's true. And I don't know if you remember the patient we discussed a few weeks ago who had 0 eggs and she had 10 follicles. It was really shocking and sad. So she did another cycle 2 months later. She did growth hormone priming, did Lupron protocol, and this week we got 8 eggs. So went from 0 to 8. So it was much better.
That is much better. Well, congratulations to her and to you. I do remember. Congratulations to her and to you. Okay. We are now going to talk a little bit about sperm. Okay. My husband has a very low sperm count, 1.8 million, and low motility. His hormones are okay, and he has no scar tissue. He saw a urologist, so we're really not sure why. On the other hand, I have a high AMH, 3.4, 26 follicles, and on my last ultrasound, everything looked fine. My blood work was good. I'm 38 and my husband's 41. I am scared of IVF because Clomid made me have ovarian hyperstimulation syndrome, and I had a hard time breathing at night. What should I do is her question.
First of all, I'm not a big fan of Clomid, and lots of people have side effects with Clomid. I would say 90% of my patients who've had side effects with Clomid do not have side effects with gonadotropins. I think they're more natural to the body. So I wouldn't be scared of IVF because I think she has a very good chance. To have an AMH of 3 at 38 is fantastic. So I think she has a very good chance of getting pregnant with IVF. And with IUI, unfortunately, it's pretty low for her age.
Yeah, and the sperm semen analysis. So
Yeah.
I'd also recommend doing a DNA fragmentation test, having your husband take supplements, and
Mm-hmm.
if he needs a little boost, if his testosterone is low, consider other drugs like Clomid or Arimidex, and then see if he's a candidate for Pixie, or if the lab also has technology like Zymote to add to your cycle. And the other thing is just to make sure you're also doing enough genetic screening. Sometimes guys who have a low count might have an abnormal chromosome analysis or a Y chromosome microdeletion. So those are the other things that I would also consider. And then there was one other thing. Oh yeah. So if you're taking Clomid after ovulation, you're going to feel like heck, like hell, actually, right?
Yep.
If you're super bloated, because no one's draining all that fluid out of your follicles. But through IVF, we actually drain all the fluid out so the ovaries shrink back down, and you're going to feel better after the egg retrieval.
Plus, Clomid has a 30-day half-life, so it stays in your body forever.
30 days? I thought it was like 7.
Mm-mm.
Oh, even more reason for me to hate it.
Yeah.
I hate it. All right. Are you ready for our next question?
Ready.
Ready. Okay. Hi, Dr. Aimee. I'm just kidding. I discovered your, I'll cut to the chase. Okay. My husband and I hit the mark of 7 years of infertility, never been pregnant. In the past 5 years, we did 5 IUIs, 2 IVF cycles. First IVF cycle was a total fiasco as most eggs were retrieved and immature. We only had a day 3 embryo. Second cycle, 2 years ago, we did ICSI. We got 4 good-looking blastocysts, none implanted. In between transfers, I had hysteroscopy, 2 of them to remove polyps. And then finally, I got a laparoscopy, and they found stage 1 to 2 endometriosis. Also, my husband has 1% morphology, and his DNA fragmentation is normal. We're now both 36. And we fall in the category of repetitive implantation failure and don't know why. What would you do with couples in our case?
Did you say they did an ERA?
No ERA.
So I would do that. I would also consider doing supplements again for both of them. I think that could help. And sometimes in situations like this, testing can help, where you actually get the sperm directly from the testicles, and that might help.
Yeah. I mean, I predict there's going to be a time where most guys will be contributing sperm in the operating room.
Yep. I think so. Although they really don't like to get there.
They don't, no.
They don't even like to put it in the cup sometimes. So
that is true. Yeah. So, I mean, for a case like this, trying for 7 years, I would say probably make sure you've done enough genetic screening. Consider genetic testing of your embryos. Take a good look at the cavity. We know you have endometriosis. And along with the ERA test, if wherever you live, you don't have access to the Receptiva test, perhaps consider just doing maybe 1 month of Depo-Lupron before you transfer and doing more IVF if that's something that you would consider. Okay, here we go. Next question. I'm 33 years old. I've had 2 embryo transfers. Both embryos were untested. My first transfer was the fresh transfer with a 3BB that resulted in a biochemical pregnancy. My second embryo transfer was a 5BA that split into twins and I miscarried. I've now done another IVF cycle. My PGT testing is pending. Both saline sono and hysteroscopy to remove polyps has already been done. My question is this: what would you recommend that I do for the next embryo transfer based on my history?
So again, ERA, Receptiva, because she's had failed before. Definitely a sonohistogram to make sure that there isn't a recurrent polyp in there. Sometimes thrombophilia panels for implantation failure have done that. And again, advanced sperm testing, I think it's good.
Yeah, I didn't bring that up. She did say that she did a DNA fragmentation test and it came back at 11%. And and they did ICSI. So I agree. I mean, I'm right there with you.
Yeah.
Same thing. I agree. Yeah. Okay. And then what about acupuncture? Do you recommend acupuncture treatment?
Absolutely. For sure. Yeah. Especially if it's the transfer, but even leading up to it and supplements.
Okay. Cool. Great. Okay. Next question. I'm 42 years old. My husband and I have been trying to conceive for over 1 year. On our 3rd IVF retrieval in June, we did a hysteroscopy and I was diagnosed with chronic endometritis. I took the month off, took antibiotics, and my doctor said that the cure rate was 97% with this treatment. So we went ahead with an IUI cycle the next month, following a second endometrial biopsy and confirmed clearance. So this is the thing. I just went through an IUI, and then my doctor said that the plasma cells were back.
How does the doctor know that without?
I'm thinking they might have seen it in the semen, maybe. Like maybe they saw a whole bunch of round cells in the sperm, and so they thought maybe she should be treated because they were having sex also.
Yeah. I don't know how they would know that. I would ask the doctor how they know that.
Right. I agree. So the question is this: is it safe to take azithromycin or the Z-Pak during my 2-week wait between my IUI and the pregnancy test?
I mean, I guess it can't hurt except for just increased resistance because it's okay to take in pregnancy.
Yeah, I agree. Lastly, since I've already had an MRI and know that I have slight adenomyosis and a small fibroid, what other diagnostic tests would you recommend? So again, she's 42 years old, and what would you recommend? Her AMH is 0.6, FSH is around 7.
So I'm sorry, she has adenomyosis.
Yes.
Unfortunately, there's no great treatment for adenomyosis. I would just recommend just trying another cycle.
Yeah, doing more IVF
Yeah.
and then consider maybe 1 month of Depo-Lupron doing a frozen embryo transfer. That's kind of how I would handle it.
Yeah.
And then at 42, if you have one normal embryo, this is when I really do that like just honest talk where I say things like, I really want you to have a pregnancy with your own DNA. Would you consider using a surrogate? Because what if like we transferred it and it doesn't work, and then she would be upset if no one talked to her about that ahead of time. So this might be a situation where using a surrogate could potentially be an important next step for this family to have a baby with their own DNA. Okay, ready for the next question?
Ready.
Okay, I'm 37 years old. I had my first egg retrieval on July 4th. We were blessed and have 1,5AA blast.
Good.
We are torn. Should we do another IVF cycle?
Depends how many babies they want to have. So I would say if they want to have another baby for the future, then yes. If they're good with one baby, I would definitely do the transfer first. But I would maybe do the ERA if they only have one to work with.
Yeah, I would say sit around the kitchen table and talk to each other and see what would happen in 5 years if you looked back and say answer the question, would you regret not having frozen another one for yourself?
Right.
If the answer is no, then just move forward with the transfer after you do implantation testing. If the answer is yes, then do it. Okay, here we go. I'm currently undergoing a cycle of IVF and my retrievals this Friday. My husband and I decided not to do PGA testing. I have 20 to 22 follicles. Here are my fertility statistics, so to speak. I'm 34, history of cancer, did chemotherapy at 21. Trying for almost 2 years, 4 failed IUIs. My AMH is high. I have PCOS treated with metformin. My husband's sperm is great. We want 2 to 3 kids. Here's the thing. If I don't do PGA testing, what would you quote me as my chance of a successful pregnancy? We'll start with that question.
I'm sorry, what was the age again?
34 years old, AMH is high, PCOS, 20 to 22 follicles.
So I would say 34, if you have one beautiful embryo, I would say you have about a 40 to 50% chance of it getting pregnant, even if it's not genetically tested.
Okay, and based on the information that I shared with you, what is the average number of embryos that you think she could get? And what is the percentage rate of each one being normal versus abnormal?
I would say probably half of them will be abnormal from the ones that make it to day 5.
Yeah,
so I usually say if you want to be really conservative, to have 2 normal embryos for 1 baby. So if she wants to have 6 embryos for 3 babies, that would be ideal.
Yeah, okay, awesome. Okay, next question. Hi, my wife and I are planning to do an IUI at home. So this is a same-sex female couple. This will be our second attempt. We ordered 4 vials of sperm. Should we use 2 vials for an IUI? When should we do it? How do we time it with our OPK? Do you have any specific advice for us?
So I have had patients try to do at home IUIs. Very few have been successful. I have had a few that have gotten pregnant, and I usually try to recommend helping them in terms of just at least coming in for ultrasounds and doing a trigger shot so we know exactly when ovulation happens. Because with the at-home kits, they tell you that you're going to ovulate in the next 24 to 36 hours, but the problem is with frozen sperm, it doesn't survive very long, and you're not putting it necessarily in the right place. You're just putting it in the vagina, really, or in the cervix. You're not putting it in the uterus. So it's less chance of getting pregnant, and you're not getting a full load for 1 vial. So it's a very small amount of sperm that you're getting.
Did you just say load, Catherine?
I sure did. I used to screen sperm donors at a sperm bank, and that's when I realized that when they come in for 1 ejaculation, they'll split those vials into 8 times.
Yeah,
so
totally.
If you're getting 1 vial from a sperm donor, you're getting 1/8 of an ejaculation, and it's half the motility.
Wow, I had no idea. How did I go all these years? I mean, I think I've known you for 20 years, and now I find this out on this show right now.
There you go.
I wonder what else I'm going to learn. This is very exciting for me.
We always learn from each other. You know that.
I know, that's true. So the other information that I would give people who are listening and you're part of a same-sex female couple is get your Tushy checked, tushymethod.com.
Yep.
Don't waste your time. The sperm is so expensive. You're going to be so annoyed if you find out that you had a big fat fibroid sitting like right inside your cavity. You know, get your tubes checked if you've had a history of chlamydia, for example. Get an ultrasound of your uterus, do your hormone test.
Thyroid.
thyroid, make
Yeah.
sure you have done enough genetic screening as well.
Exactly.
Okay, next question. I'm 33 years old. I'm really not. But this woman is. My husband is 35. We want a baby for over 2.5 years, but still nothing has happened. I have an AMH of 0.8. My husband has low morphology and he's a truck driver. Our doctor suggested IVF. She even said that supplements on his sperm won't help much, and I'm trying to improve my weight. I take supplements like folic acid and vitamin D. In our case, we cannot afford IVF. Will Femera help? Can you help us? So what do you think?
I mean, Femara can help if she has regular periods, less so than if she has irregular periods. I do think supplements can help, especially with morphology. I would recommend that, I know he's a truck driver, but I would recommend if he can stop more frequently, maybe every hour, just try to stand up and just go to rest area and try to not drive for prolonged periods of time because it's heated down there. I know a lot of the newer, fancier cars, I'm not sure about the trucks, have a button that you can push to get cooler air coming from the chair. So that would be kind of a good little thing to do. I wouldn't suggest ice packs or anything like that.
Oh, I totally would. I would suggest ice packs. I'd say go get your
That's
snowballs.
mean. You know,
It
these
is
have
not.
everywhere.
No, Catherine, they sell them. They're called snowballs. Like literally, there's a company that sells these gel packs. No, seriously. You wear the underwear. I would tell them to go commando. I would say
What do you
drive your
think?
truck commando.
If guys won't do a semen analysis, you think they'll wear ice packs?
Guys will now do a semen analysis. Meet Fellow, MEET fellow.com. And you can use Egg Whisperer. I think you might get like 20% off. They should send me $5, but they don't. I'm just kidding. But it's home semen analysis,
Yes.
Catherine.
No,
They just ship the kit. So I think this will increase the uptick, or I don't even know what I'm trying to say here. I think more guys will do it rather than go to like a creepy closet in a clinic. Do you guys have a creepy closet?
We have 2 rooms.
2 rooms. I'm sure they're very nice. I'm sure they're nice. Yeah, but for them, I would say Femera could help. I mean, her AMH is 0.8. If she can ovulate 2 to 3 eggs, diagnosis before treatment, right? So if you know there's a sperm issue, she could totally benefit from potentially doing IUI. But I would have him get his balls checked, right? Check under the hood, see if there's a varicocele. That might be the reason over being a truck driver and being exposed to all that heat. What?
They could freeze the sperm while he's away, and then she could do an insemination if he's out of town. And it's not so expensive.
And that would cool the sperm down.
And you could use more of it.
That's true. I've done that before. I haven't found, I mean, I've been so, you and I are like, if there's a way, we're going to try and figure it out.
For sure.
That's true. Okay. Next question. I love your show, appreciating everything that you're doing. You really make the infertility world a better place. You're so patient and helpful. Well, thank you.
You are.
Okay, here we go. I'm 44 and we're planning an FET for our embryo with a donor egg. We just did 1 successful IUI and that's it. We've been thinking recently about the ERA test. What do you think? Do you think it's really that important we should do it?
I think if there's not a lot of embryos, yes. If there's 10 normal embryos from the donor, I would say you could just do a transfer without
I agree. And then she gives us this list of things. Would you add any of these things on? HCG wash, intralipids, PRP, embryo glue. What is your opinion?
What was the first one you said?
HCG wash.
I wouldn't do any of those.
Okay. Great. And then how many hours of progesterone do you usually recommend before your transfer is what she's asking.
So usually I do the transfers on the 6th day of progesterone, and the progesterone usually starts at night on the first day. But what I've noticed now that I've done more ERAs is that a lot of people need an extra day of progesterone. So on the 7th day. So it depends. But usually the 6th day of progesterone is what I usually recommend.
Got it. Yeah, for me, it's around 130, 138 hours. That's generally the number of hours. And she just live chatted us that she has 3 blastocysts from donor eggs.
Oh, okay, great. So it depends again on how many kids she wants to have. If she wants to have just 1 kid, I would probably just do a transfer, not do the ERA right away. I know you would probably do the ERA first. But if
she has 3 embryos. If they're beautiful, I mean, it also depends on the gender if they're genetically tested. I mean, if she has like 1 girl and 2 boys and she really wants a girl, then I would say do the ERA test and then transfer the girl first, right?
Yeah. But if she just wants 1 baby, I think she could just do 1 transfer and hopefully it works. And if not, then she could consider doing the ERA.
Yeah, I agree with you. And you guys, if you're 44, I mean, people look at me like I have like a horn coming out of my head when I say things like, how many kids do you want? And you're 44, like you can do it. Like if you're young and healthy and you're taking really good care of yourself and you want to have 2 kids and you're having your first at 44, believe it or not, you can come back to Catherine or me and do it in 2 years from now.
Yeah, I just had a patient who was 51 with their 2nd kid, first one at 48. But I do make sure that their cardiac clearance is all perfect. I want to make sure they're all healthy to have another baby, have them see my doctors.
Right. I agree. I've had two 51-year-olds deliver in 2020 so far. They both did awesome.
Amazing.
Yeah. Okay, here we go. I'm on my second Clomid cycle. I'm 31 with PCOS. It's mild. I do get periods every 30 to 40 days. I'm not overweight. On day 11, I had 6 follicles. Largest was 17 and 18. My lining was 7.4, estradiol 422. They triggered me. Should I have been triggered that early? What would you have done if it were you?
If it was 17 and 18?
Yeah.
I would.
My lining was 7.4.
Yeah, maybe I would add estrogen just because the lining is a little bit on the thin side.
Yeah. Yeah. I feel like the reason why they probably triggered her is because if she had 6 measurable follicles, they might have been afraid that she was going to have triplets or quadruplets.
Right. Exactly.
Okay. Can you talk about HGH today? I'm 34 years old, endometriosis. I got 11 eggs and only 1 blast and was abnormal. My reproductive endocrinologist wants to try the same protocol with HGH and testosterone gel. Thank you. What do you think?
I definitely have used growth hormone if somebody doesn't have a lot of embryos. I think it works. I start it every day when the other medications start. So I think it's great. I would definitely recommend that. I would agree with her. Reproductive endocrinologist to use that. Testosterone, I haven't used it a whole lot. I don't know about you, but I haven't used it a lot.
I agree. I mean, I know there's some clinics that use it a lot as part of their priming protocol, but we all have our special recipes, you know, like you have your thing that works really awesome and you feel really good with it. And I have my thing. And when people want me to do their thing because they read it somewhere on some blog of another doctor, and I'm like, I mean, I'm happy to help you, but why wouldn't you just want to do what I think would work best for you in my hands, right?
Right.
Okay, so Catherine, I have a couple more questions, and then we're going to get to the live chatted questions up here. And for you guys who have sent questions in, if I didn't ask your question today or answer it, not ask it, if I didn't answer it, please send it again. My apologies for not answering it. I truly try and get to every single question. And if I didn't, it doesn't mean that your question isn't important to me. It's super important to me. It just means I forgot to put it on the list or I forgot to print it out or take it off the printer. Okay, here's the next question. What would the approximate success rate be from IVF for someone who's 31 years old with suspected PCOS due to long cycles and also with a high antral follicle count of 49? What would you expect?
If you have a normal embryo, I would say 50% to 70% chance of getting pregnant on the first try. Mm-hmm. If you don't do genetic testing, obviously it's more like 40-50%.
Yeah, I mean, I'd say for someone who's 31 years old, your chance of pregnancy without genetic testing is at least 65% the first transfer, at least. Okay, here are the last 3 emailed questions. Here we go. Does regular IVF in women over 40 increase the chance of aneuploid embryos? I saw a few articles in the literature recommending mini IVF as a better strategy. What do you think?
I don't think so. I think regular IVF is better because you have more embryos to screen.
Yeah, I mean, I think it honestly depends on how many eggs you have. You've probably heard me say this. Less is more if you have less. More is always more if you have more. But if you have less, celebrate the less because sometimes less could be more.
Wow, you're gonna have to email that one. That's awesome. I like
No,
that.
I just came up with that. It makes me dizzy every time I say it, but I think you understand my point. You know,
awesome.
more bags is always better. Okay, next question.
But sometimes less is more.
Yes, that's true. What would you tell someone who is terrified of IVF but wants to get pregnant and is having difficulty? I'm 31 years old, have had a few miscarriages, terrified of needles, especially those darn progesterone ones. See, Catherine, people are afraid of those.
Yes.
I faint at blood work sometimes. I'm also sensitive to medications and worry about side effects, both short and long term. How would you counsel someone like that?
So number one, I would have her come into my office to do the shots, to have my nurses do her shots.
Oh, you do that too? You're such a nice doctor. Yeah. I do that too.
Because some people just can't do it.
Do you have people come to your house?
So yes, they've come because when they run out of medications, I have everything in my fridge. Yes, absolutely.
Me too. I seriously have everything in my fridge. I have a Ganirelix. I have an HCG always at home just in case people mess it up. I've
met people in a Starbucks parking lot once because I had to go to a beach. This is a long time ago when you could go to beaches, and brought her meds because she was far away. But yes, but in terms of other things, I would. What was the question again? I forgot. It's been a long week.
I think you answered it, Catherine. We're going to go to the next question. Here we go. I'm 32 years old with PCOS. I had 2 spontaneous pregnancies in 2019. Unfortunately, they were both abnormal. We're trying Clomid and a trigger shot for a few rounds since my periods are really long, 30 to 40 days. My first Clomid cycle yielded a 19.5 millimeter follicle at trigger, but no pregnancy. Currently, I'm in my 2-week wait. My question is this. Do you think I have terrible egg quality, or is this just bad luck. My husband and I had a full genetic workup. Everything came back fine. I just don't understand why everyone else is getting pregnant so easily, and I had 2 unfortunate situations and don't get pregnant every month I try. What would you tell someone like that?
Well, I think it's just statistics. I think that obviously the more you try, the more chances are you're going to get pregnant. And I'm not a big fan of Clomid, so I would get more aggressive personally.
That's probably why we're friends. Don't you think?
I'm not a big fan of Clomid.
I think that should be like a question, like, do you like Clomid? And the answer is no. I'm like, we can be friends.
And you know what really bugs me? The 42-year-olds that are on Clomid for 3 years before they come see me. I feel like that's just stabbed me in the heart.
I know. What really bugs me is those people that brag about getting pregnant so easily. Those are the annoying people that annoy me too. Okay.
And also when you're having infertility, I think you're more aware of people getting pregnant. And also as people get older, there's obviously more people getting pregnant nowadays at these ages. So.
Right. I agree. Okay. Are you ready for the live chatted questions?
Yes.
Catherine? Can I drink during the 2-week wait?
So I would say, to be on the safe side, I mean, if you have to go to a wedding and have like a drink, I think it's fine. But I usually recommend no alcohol when you think you're pregnant, just in the follicular phase. So before ovulation, I usually say up to 2 drinks per week. But if you have to have a sip because you're at a business party and they're going to get suspicious if you're not drinking, that's fine to have a little bit of a drink. But I always tell people to have fake Cosmos, like virgin Cosmos.
Just diet tonic water or tonic water, or just soda water. No one will know. Or 7-Up. Okay. Next question. Just transferred 2 day 3 embryos that were fair quality and had low rising HCG levels, 32, 44, 52. And I also got an HCG booster. I assume the embryos are just not strong enough. What do you think?
I don't know about the HCG booster.
A lot of people do that to substitute for progesterone. They give HCG.
But there were studies that didn't show that it made a big difference.
No, I mean, some people don't have access to progesterone like we do, but I agree.
Right. So the HCGs were what again?
I passed it.
You passed it. I'm sorry. But it doesn't look great.
Focus.
They weren't doubling.
Okay, 32, 44, and 52. And obviously, we're not trying to make fun. We're sorry that you're going through this. But obviously, we want to give you this information.
Yeah,
so you're right.
They're not good numbers, unfortunately.
No, they're not. And it just sucks to, anytime we tell a patient they're pregnant, obviously, when it doesn't work out, it hurts you and me and the patient and her extended family.
And what I would tell them is that because they got pregnant, they have a higher chance of getting pregnant again. Because people that get pregnant, even if it's a chemical, have a higher chance of getting pregnant next time. So it's a good thing that you got pregnant.
I mean, it's not a bad thing. I mean, I think it just gets you fired up and you just know that you were almost there, and it just makes you that much more dedicated to the process, and you want to keep trying for some people. Okay, next question. Do you continue aspirin after the frozen embryo transfer?
I do.
Me too.
So honestly, I leave it up to the OB doctors because some they now continue it throughout the pregnancy to prevent preeclampsia.
Yeah, and preterm labor. And a lot of OBGYNs are even increasing the dose. Like I put them on 81 milligrams and they're doubling the dose nowadays.
But then not past 30 weeks because then you get a problems with babies' hearts.
Yeah. Okay. So next question. Any good protocols for endometriosis? Any good IVF protocols for endometriosis?
I don't have a special endometriosis protocol, but sometimes Lupron can help for patients with endometriosis. And sometimes I feel like ICSI can help in patients with endometriosis. I think their eggs are tougher to get into. So IVF doesn't result as much fertilization.
Yeah, I mean, I think with endometriosis is just really tricky. I think it's maximizing the lifestyle part, like being as fit as possible, as lean as possible, taking supplements, decreasing stress, all that kind of stuff, acupuncture. And then I have my endometriosis supplements that I know you do too, that can potentially help. And with endometriosis, we're thinking of egg quality, right? So we're thinking of HGH, CoQ10. And then someone's asking, what are the benefits of N-acetylcysteine?
You want to answer that?
Sure. It just can help. It's been shown to treat potentially endometriosis, okay, or shrink endometriosis lesions. And there is a metabolic benefit. So I also recommend it for patients who have PCOS. So it might help PCOS patients as well. So next question is, can you take over-the-counter melatonin in the 2-week wait and in pregnancy? What do you think, Catherine?
I don't recommend it in pregnancy. I just think there's no known effects. So I wouldn't.
So there has been some, I wish I could just Google it or go into PubMed and look at it. So there are some studies looking at melatonin in pregnancy as a potentially having some sort of neuroprotective effect. And again, I'm just like you. I don't tell patients to take it during pregnancy, But, I think it's okay during the 2-week wait. But in pregnancy, I say, I don't know that you necessarily need to take it.
Yeah.
Okay, so next question is, my goodness, this baby making is complicated. Thank goodness we have you, Dr. D, to figure it out. Well, that's really nice, Catherine. Her name is Karen.
Thanks.
Next question is, can you ask Dr. D what she thinks my best next steps should be?
That must be your patient.
She must be. So we'll go to the next question and then I'll kind of sprinkle in the story. What are the success rates of doing genetically normal frozen embryo without hormones so I can continue nursing my firstborn? Do either one of you do that? What do you think?
I have done that before, but you'd have to basically go by ovulation. You'd have to do a natural transfer, go by ovulation and not do any medication. So you could continue to breastfeed. Or if you did progesterone, obviously you'd have to pump and dump for 10 weeks.
Yeah, I agree. I mean, that's hard because the hormones will decrease the breastfeeding. So if your goal is to really breastfeed and breastfeed a lot, the hormones can definitely make it slow down. But also another pregnancy can make it slow down too.
It makes it slow down, yeah. And it's tough to do both.
It is tough. When do you recommend doing a laparoscopy for endometriosis? I have a 13 millimeter endometrioma on my left ovary. My doctor doesn't want to operate unless I have a lot of pain. What do you think?
So I usually don't recommend surgery for endometriosis unless people have pain, especially not for a 13 millimeter endometrioma.
Yeah.
Only if they have severe pain or a hydrosalpinx to block that.
Okay. What are your thoughts on L-arginine and vitamin E for transfer?
It's interesting because L-arginine has a bad rep sometimes. So I used to use it for everybody. It used to be part of my supplements, but now I've taken it off because I think a lot of acupuncturists don't like to use it. So that one, not so much. And what was the second one?
Vitamin E.
Vitamin E, I think it's good for transfers. I think it can help with lining for people with thin linings. I don't use it for everybody.
I agree. Yeah. Okay, someone's saying, love you, ladies. See you next week. Very sweet. I love your positivity. This is very encouraging. Okay, here we go. I'm 43 years old trying to get pregnant. I've had 3 failed IVF cycles. I'm trying to have 2 babies. Every time I do IVF, I only get 1 to 2 max eggs. Should I forget about using my eggs or opt for donor?
Well, it depends on her, obviously. If she has it in her to try again and again, try a different supplement, maybe another doctor's opinion, supplements and acupuncture, different protocol. But I usually say if you've done 3 to 4 cycles and you don't have any normal embryos, I think it's time to move on to egg donor. Or sometimes what I've done is do both. Put 1 embryo from the patient and 1 from the donor, and you just don't know which one takes.
Yeah, I mean, I love your outlook. It's very similar to mine. So when most patients show up at a fertility doctor at 43, a lot of times what they hear is, you have to use a donor egg or else I won't help you. But you and I are like, let's do this. Let's try. And you just said like 3 to 4 times. I mean, it can take 4 to even 6 cycles to get a healthy embryo for someone who's 43, if there's still a viable egg left. But we're going to certainly help you, especially if you're still having fertilization and if your embryos are growing, right?
Right.
I mean, if you aren't getting a fertilized egg, then would you agree that at that point, it probably makes sense to stop?
Yeah, if you're just not even getting good quality eggs and even make it to fertilization, I would stop sooner.
Yeah, sure. I agree. Okay, here's another question. I'm 43, have had 3 failed IUIs. I'm in my first IVF cycle. My egg retrieval is coming up on Tuesday. I have 5 follicles. I'm planning on a fresh transfer. Are my chances low? What are my chances if I were to move to donor egg after this?
So obviously with donor egg, I'd say the chances are more like 50, 60, 70%, depending if they do genetic testing or not. But if they do a fresh transfer, I want to make sure that they're not doing a Lupron trigger, because I think that can decrease the chance of getting pregnant. So I would want to do either Ovidrel or ATG for a trigger. And then I would start progesterone shots, ideally, the day after the retrieval to improve chances, and baby aspirin.
Yeah. So what would you quote someone who has 5 follicles, 43 years old? We don't know how many eggs she has yet. We don't know how many blasts she has yet. But let's just say she gets 2 blasts. What would you quote her as a pregnancy rate at 43?
If she has 2 beautiful blasts and you put them in, I would say maybe 15%, 10, 15% at best.
Okay, thank you.
How about you?
I mean, I would say, like 10%.
Yeah.
10, 15%.
Right.
Okay, because I mean, the thing is at 43, a blastocyst, if you look at the rates, has about a 10 to 12% chance of being genetically normal, right?
Right.
So, okay. Someone says that I feel like I would travel to either of you for how encouraging and positive you are. Well, thank you.
That's so sweet.
Yeah, but who do you like more, me or Catherine?
But we want you to be careful. Maybe if you get an RV.
Then you can go between us. Okay. Can you please talk about the thrombophilia panel, specifically an abnormal lupus anticoagulant? I recently miscarried. Could this have been the cause? My concern, however, is having blood thinner injections. What do you think?
So, I mean, I would do the full thrombophilia panel, which includes the genetic tests, which are factor V Leiden, prothrombin, 20210 mutation. The way you remember that, it's like 90210, but it's
20210.
And then the MTHFR mutation, I won't tell you how my patients remember that one. And
I think I have a
factor
feeling.
V,
I have a feeling as to how.
Factor V, those are the three genetic ones. And then the protein S, protein C, antithrombin 3, anticardiolipin, beta-2 glycoprotein. So I would do the full thrombophilia panel. And then I usually have them being seen by a hematologist. And most of the time, they recommend Lovenox at the time of the progesterone start.
Okay. So now I have another question that was live chatted to us. I'm going to read it right now. It's on the screen next to me. Can I please ask you a question? I have PCOS, insulin resistant. I don't ovulate on my own. I have lost 40 pounds and I lowered my insulin resistance and inflammation. Way to go. Here's the thing. I'm 40 years old and my AMH is 0.8. My follicle count is between 7 to 10 and the last 2 cycles have been 7 to 8 respectively. I primed with Androgel for a month and now I'm doing stimulation. Do you think a low-dose protocol would yield more or higher quality embryos? What do you think?
Well, first of all, I would not have primed with Androgel in somebody with PCOS because people who have PCOS have a high testosterone levels already. So I would not have done that personally. The MinStim, I'm not a big fan of. So again, I would just do a regular IVF and even add growth hormone since she doesn't have a lot of follicles and she's 40.
Yeah, I mean, she has more than, I mean, to have that number of follicles, anything over 3, I get pretty excited about for women over 40. But I agree. The Androgel part, I'm not too excited about. I'm right there with you. Okay. Here's another question. I'm 45. I live in Miami. I have, looks like HSG is normal. My AMH is fine. My mom had me and my brother easily. Are you ready for this? At 43 and 45. Wow. Easily. Holy smokes. Those are some fertility genes she has. Should I go straight to IVF or try 2-3 cycles of IUI first? What do you think?
I mean, obviously, again, depends on number of babies. So if it's one baby, you could try IUI. But if you
She's 45, Catherine, and her mom had kids at 43. She needs to go right to IVF. Come on.
Honestly, IUI versus IVF at 45 is not going to make a big difference in pregnancy.
I know, but she has the genes and she has a good AMH, and you know.
Yeah, no? I mean, yes. I mean, I would offer her both. Depends on obviously if insurance covers it, if what she wants to do, but. I don't think it makes a big difference at 45 IUI versus IVF success rates, honestly.
I mean, I think that if you're someone who has a decent number of eggs, then it makes sense to do IVF. But I think the reason why IUI is the same is most women, you can't even get them to grow more than one egg.
3 follicles.
So then IUI is the same as IVF in those cases. But I think if you tease out the number of follicles and eggs you can get from these women, I bet that the chances are higher with IVF. I'm just wondering. Yeah. I mean, we're talking about a pretty small chance. We're talking about like 1%, right? I mean, Okay, here we go. Someone just added, you gave me hope, 44 and 2 kids I dream about. Is it doable? Yeah, it is.
Anything is possible as long as you're not in menopause. And even then you can use a donor egg.
Exactly. Secondary infertility. My daughter's almost 3. I have an AMH of 0.59, 33 years old. Everything else is normal. 3 failed IUIs. I'm going to start IVF in a few weeks. Do you think I have good odds? What do you think?
Well, I don't just look at the AMH. I look at the follicle count and other factors, but I call it a mean hormone because everybody just gets tied out on that one. But I think it's because of the age that's more important than the AMH level personally. So it's possible.
I agree. I'm 39 years old, IVF in October of 2019, 11 eggs, 8 mature, 5 day 3 embryos. AMH is 1.4, FSH is 12. First ended in a miscarriage, and now I've had a biochemical. What would you think I should do next?
Sounds like genetic testing would be the way to go.
Right. Do another cycle and consider PGT of your embryos. Okay. Do you do egg retrievals with local anesthesia? I'm allergic to general.
Well, it depends on what they mean by allergic. So there's other medications that they can use. Some people are allergic to propofol, and they can still get fentanyl, which helps with the pain. I have done retrievals under local anesthesia or even without anesthesia for some patients who really refuse to have anesthesia. I personally would never do that myself. I would not want a needle in there without anesthesia. But I have done it, so it's possible. In fact, I think in Michigan, one place I interviewed at, they would never do anesthesia, and I refused. There.
Yeah, I use my voice sometimes. It's very soothing for people.
Yeah.
Kidding.
And people deliver vaginally without epidurals. I think people
Right.
get the retrieval.
Right, exactly. In regards to acupuncture, how many sessions do you recommend before an embryo transfer?
So I usually recommend once or twice a week, and then the day of the transfer, before and after transfer, and then maybe one more time a few days after, around the time of implantation, like 2 to 3 days afterwards.
Okay, Catherine, 10 more seconds. Yes, no questions. Is 3BB embryo good for a first embryo transfer?
Not great.
Really? I think that's good. 3BB, it's good.
Okay.
Okay. How concerned should I be at 29 with an AMH of 0.99?
Just a little bit concerned.
Just do IVF, freeze embryos for yourself. I agree, just a little bit. I heard determining between AA and AB is all subjective. Do you know what the difference is?
I personally don't use that scale. I think
Got
it's very similar, so I don't think they're both good embryos.
Catherine, we're almost done. I love you.
Love
I'll
you.
see you next week.